right, so my name is Jennifer Powers, and I'm a dermatologist, and a dermatologist who sees a lot of melanoma patients and pigmented lesion patients. I worked here at Duke Dermatology for the last 2 years and have recently relocated to the University of Iowa. And so just for everyone's edification, in case you were wondering where Iowa is, I included a map because when I told people I was moving to Iowa, many people said, oh, are you moving to Idaho? Is that out west? So Iowa is in the center of the United States. There is a lot of corn, I assure you. But we also have some very nice patients there. And I'm looking forward to taking my skills now to the heartland where I grew up. So home of the Hawkeyes, and it so far seems to be a great place. So this evening, I'm looking forward to talking with you a little bit about the dermatologist's perspective of diagnosing and treating melanoma. So I want to talk to you about unpacking the melanoma epidemic, about the dermatologist's role in early detection, and future landscapes in terms of prevention of melanoma. So you may or may not know that the skin is the largest organ in the human body. And while melanoma can affect many areas in the human body, the skin melanoma tends to be the one we think about most often. And how exactly are skin cancers born? Well, we hear a lot about UV light. You know that the sun is part of the problem. We know that tanning beds can be part of the problem. And so it is this UV light or ultraviolet light that actually causes changes within the cells of the skin. And when those pigment cells change and develop these mutations, you actually can develop melanomas within the skin. And typically, those are what we refer to as the superficial spreading melanomas. So why exactly do we say that there is a melanoma epidemic? Well, you probably are aware that melanoma has been on the rise for the last many decades. And in fact, in the past couple years, it's been almost up to 10,000 US deaths from melanoma per year. We then, of course, ask ourselves the question, well, how and why do those occur? So this graph from the CDC's database basically shows that increase in melanoma incidence since 1975 and projected out through 2020. But what is particularly interesting about the trends with those occurrences is that there's actually also been a change in how many people succumb to melanoma, and that really gets everyone's attention. So if you think about it and you look at the graph, melanoma there is in the red, and looking at the data from 1975 to 2007, the incidence of deaths from melanoma was changing at a much greater rate and in a positive direction as compared to many other cancers, many other preventable cancers, like prostate cancer, breast cancer, colorectal cancer. And that is why we have had so much celebration in the last couple years about the many new drugs that have come out to help change this landscape. And you're going to be hearing about more of those later this evening. So I like to think of this quote from Coco Chanel, which says, you can be gorgeous at 30, charming at 40, and irresistible for the rest of your life, and want to ask, did she mean while tan? Because many of us attribute the sort of fascination with tanning to Coco Chanel and her promoting that fashion trend. Many of you are aware that tanning and sunlight have been attributed to many melanoma cases over the past many decades. And in fact, when the Surgeon General wrote the report about the skin cancer risk, the Surgeon General's call to action to prevent skin cancer, there was a lot of interesting data covering to what extent adult sunburns also contribute to melanoma risk. So it's not just the sunburns that people experience in childhood, but it's also the sunburns that people experience as adults, particularly when those sunburns include blistering. So what exactly do we know about tanning bed use? Well, the World Health Organization declared tanning beds a Class 1 carcinogen within the last few years. And that came after many decades of research that demonstrated that with every increased incidence of exposure to a tanning bed or an artificial light device, that the risk for melanoma would correlatively increase. There is another trend related to melanoma incidence that deserves some further investigation, and that's thinking about who is actually succumbing to melanoma. So 50% of all melanoma deaths are in white men 50 years of age and above. And with that, this graph actually highlights it beautifully. You can see that in the 65 plus age range, there is a much greater rate of deaths in that particular group. And within the melanoma epidemiology world, we often say that much of our research and our prevention efforts should be marketed in Field and Stream magazine, because that might be the best way to reach that demographic. But I bring that up just to say that there are lots of questions about why is this particular group so at risk for melanoma, and why are they so at risk for having consequences from that melanoma. We could have a whole talk actually about that, but I'll just leave it to say that there are thoughts about it being both related to biology as well as behavior. And one incidence factor in particular relates to veteran service. So I like to call this the South Pacific effect. So many of the sunburns that people get that lead to melanoma are thought to be sort of incidental extreme exposures. So it's not the person who goes and gets tanned and the same sun exposure day in, day out. It's actually the person who goes from a temperate climate and then travels to somewhere in the tropics, somewhere between those closer latitudes, those equatorial latitudes, and get those extreme sunburns. Those are the changes that we think really lead to the biology of many of our sun-induced melanomas. And so because of that, there's been a lot of interest in the deployment effect. Could there be a link between service in equatorial latitudes and melanoma in this adult male population? As I said, we could have an entire talk on this, but needless to say, my grandfather here, who's 92 and served in the South Pacific during World War II, just got treated for his melanoma on the back. So I've certainly seen somewhat of that trend play out in my own family. The modern version of that tale is related to a project that I did in Nashville at the Vanderbilt VA. And there, we actually asked veterans who had recently returned from their time in Iraq and Afghanistan about the availability of sun protection. We were surprised that there was very sporadic and often inadequate access to things like sunscreen, sunglasses, hats and headgear, and shade structures. And in fact, the subjects requested and actually stated that they wanted to have better access to things like long pants, long shirt sleeves, hats and headgear, and sunglasses. So we wonder if there may be potential opportunities there for further preventative efforts. And that trend definitely requires some additional research be done to further prove that connection. So switching gears for a second, I just wanted to talk to you about, what do we do about these risks and how do we approach the prevention question? Well, we know that it's important to seek prompt care for changing moles. And all of you, I'm sure, are experts at that. In addition to seeing your dermatologist for regular skin exams, when something is changing, you want to get it checked out. It's very important to be involved in protecting your skin, especially after you've had a melanoma. And so that entails covering all parts of the skin that are exposed, as well as wearing a daily sunscreen. And we'll talk more about that. And obviously, avoiding tanning beds and working on that legislation is an important effort that cannot be minimalized. So I like this quote from one of the dermatologists in Australia that says, "Melanoma writes its message in the skin with its own ink and for all of us to see." And while that may not be true with every case, in a lot of the cases that come to my office, these are vital words, because this is really the core of what I do every day with patients. So this study was really critical in demonstrating that doctor-led skin exams matter, because doctors catch thinner melanomas than patients. And with that, I present to you the skin exam, which is what I do every day. So I have a patient that comes in, they have multiple nevi, so multiple moles, some of which are mildly dysplastic, whereas this one in particular, with some asymmetry and some color variation, ends up being a melanoma because we're able to pick out the ugly duckling. And when it comes to malignant melanoma, we often say, have you thought about the ABCDEs? So not every melanoma is going to cover all of these categories, but many of them will at least hit a few of these factors. So A stands for asymmetry, B for border irregularity, C for color variation, D for diameter bigger than the head of a pencil eraser or 6 millimeters, and E for evolving. And for those of you who may not be familiar with this, I think this picture really depicts the critical areas for patients, which are that in women and men, both the back is a large area for melanomas, and in women, the backs of the legs is also one of the more frequently found sites for melanoma. Many of you are familiar with the dermatoscope, which is a device that we use in clinic. It actually takes advantage of polarized light, and it allows us to visualize those changes, those ABCDE factors, at a very magnified view. And so, when we look at something like this, we're often saying, well, there's a very dark area over here, whereas it's very fuzzy and paler, which means it's asymmetric. The colors are quite varied. And while the pigment network here may be very intact, over here, these areas are quite blurred. And so, that's a tool that many dermatologists are using these days and finding is an important adjunct to the sort of naked eye skin exam. We also are known for our cameras. You may have been photographed either in your dermatologist's office, or they may have sent you to a group to have those total body photography images taken. And those just allow us to compare moles from one visit to the next and can be a really important tool in the dermatology clinic. And as we always say when we're taking the photos, we promise we're not uploading these to YouTube or Facebook. These are simply for clinical use only. So in terms of surveillance, how often do you need those skin exams? Well, some of it is subjective, but we typically do see patients every 3 to 4 months for the first year after diagnosis, and for at least every 6 months after a melanoma in situ. And typically we will see patients every 6 to 12 months for many years following that. And it really depends on the patient and how, if the patient has other issues as well. But most of these patients we will end up seeing annually for the rest of their lives. Because again, going back to that other point, we know that doctors catch thinner melanomas than patients. And so that's a really important preventative strategy in terms of getting melanomas when they are diagnosed earlier, which we all know leads to better outcomes. Another fun fact is that wives are actually better at looking at their spouses and picking things up than the husbands are. So I wish we had enough time to watch it, but I can direct you to this website, which actually is directed by the American Academy of Dermatology, and it is called Check Him Out. It is a campaign to encourage women to look at their husbands if they've had skin lesions. Because again, as one of my patients once told me, how am I expected to see something on my back? And that's really true. If you have somebody in your house who can keep an eye on you, that can be one of the most protective strategies. And men, even if you're 9 times behind the women, I encourage you to work on changing that statistic. So keep that in mind. Okay, so this is something I get to say many times in a day, which is that sun protection is absolutely critical when it comes to preventing melanoma. There was a landmark study that came out in 2010. It was done in Australia, and they actually showed that daily sunscreen for melanoma patients cuts that melanoma risk in half. So I always tell my melanoma patients every day, put it on like it's your deodorant to the face, to the dorsal hands, any exposed skin, and that is going to go a long way to keep you in sort of the best preventative strategies. Moreover, it's good anti-aging treatment, so it kills two birds with one stone. Other things you can do, seeking out shade structures, of course, is sometimes easier said than done, but if they're there, make use of them, particularly between the hours of 10 a.m. and 2 p.m. Hats, sunglasses are also quite effective at keeping the sun out. And in fact, hair is an important factor to consider. So men who have exposed scalps, that's a risk factor. And you need to definitely put something on in addition to that if you have exposed skin on the head and neck. And then avoiding burns, examining the skin monthly, and doing regular exams with the dermatologist are part of that whole package. So, this is an exciting time to be in the melanoma prevention field. There are so many interesting studies ranging from research on military vets and melanoma to new diagnostic tools for melanoma detection. I get questions all the time about some of the new devices that are being looked at, and at this point, many of them are just in research studies, so none of them are ready for prime time. But it is exciting to think of what could be alongside your dermatologist in the future. And lastly, I'll just say that there are a lot of interesting studies on things in our foods that contribute to sun protection, even things like green tea, high antioxidant fruits. So I always encourage my melanoma patients to make sure they're getting a healthy diet that's rich in fruits and vegetables and all of those good things your grandmother told you to do. So it's my greatest pleasure to have been with you this evening, and I'll just leave you with this picture of one of my sons. This is what a dermatologist child looks like at the beach. We do go to the beach, but we always cover up. So thanks again to Dr. Salama for inviting me, and I will let the next presenters come forward. So thank you, guys.